hallux, and then the metatarsals. So here we have the phalanges right here that make up the digits. With the foot, it's a little bit easier to distinguish the phalanges, where obviously the phalanges that are distal still have the rounded ends. But what you'll see is that the distal phalanges are very small, and the middle phalanges are a little bit larger, and then the proximal phalanges are much larger in size than that of the middle and the distal. So it's pretty easy to distinguish the different phalanges for the foot as opposed to the hand, where you can tell like the fingers of the hand are much longer than the digits of the toes. The digits of the toes are probably about half the length or so of that of the fingers. So the bones have to then compensate for that. The metatarsals are also easy to identify and distinguish in comparison to the phalanges and the other bones of the foot. So you really should not have a tough time with these at all. Okay? Now, it's the tarsals that are going to be probably the trickiest part. And each bone is kind of unique in shape. The easiest bone to identify is this bone right here, which is the calcaneus bone. This is the heel of your foot. Right in this back area here of the calcaneus is where the calcaneus tendon would attach to the heel of the foot and literally pull the heel upwards, causing what we would call plantar flexion. Okay? So that's what that is right there in that spot. And of course, what sits on top of the calcaneus is this bone right here, and this is called the talus. It is the talus that is the pivot point for the foot. So you have the medial and lateral malleolus from the tibia and the fibula wrapping around the talus, and so they kind of attach right here on either side, and then this pivots in between them, like that, okay? And that's how your foot can actually do dorsiflexion and plantar flexion, okay? And so that's the talus. Now, this bone right here is the navicular, okay? And on top of it sits three cuneiform bones. This navicular is very similar to that of the scaphoid in the wrist, where it has three bones sitting on top of it. Where in the wrist you have the trapezium, the trapezoid, and the capitate that all sit on top of the scaphoid. You have the first, second, and third cuneiform sitting on top of the navicular or in the foot. Now, the cuneiforms are also known, first, second, and third cuneiforms are also known as the medial, intermediate, and lateral cuneiforms. So you can use those simultaneously, okay, or interchangeably, I guess would be the better word. And so that's what these are here. So here we have the first, second, and third cuneiforms right there. And then next to it is the cuboid, which is kind of cube shape, hence the name cuboid. So.
Which one's lateral, which one's medial? This is lateral?
Oh, no, this is medial. Oh. The medial is found underneath the big toe. Okay. And then the lateral is found underneath the third digit. It gets progressively smaller as we move over. In fact, do you have